So you want to lose weight and keep it off. I'm Dr. Kasra Haghighat, practicing family medicine, urgent care and walk-in clinic in the past 15 years, and have seen over 250,000 patient encounters. We'll be talking to you about the facts about losing weight. I'm going to give away the secrets about the right way of losing the weight to keep it off. No more yo-yo diets, no more looking at different videos on YouTube, trying to learn from TV doctors or gimmicks. And often when you look at these videos, they tell you about what to eat to lose weight. Well, I'm gonna tell you how to eat right and what to avoid to lose weight. So stay tuned for the facts on losing weight and keeping it off. So to make it easy and simple, 3,500 calories is equal to 1 pound, meaning that if you were to reduce your intake by 3,500 calories or increase your exercise or output by 3,500 calories, you will lose 1 pound. So let's talk about 350 calories. So 350 calories a day, you can have 2 less pieces of bread, that's 100 calories, and you can do about half an hour of bike riding or stationary bike at home or elliptical or any other form of exercise that you like, and that's equal to 350 calories. Assuming that everything else stays the same, so you don't change anything else, you will lose 1 pound every 10 days. That would be about 3 pounds a month. That would be about 36 pounds a year. When was the last time you lost 36 pounds? In fact, how many years have you been trying to lose some weight and you haven't? So this is huge. So some people tell me, oh, that's 1 pound every 10 days, that's not enough. That is huge. I'm gonna tell you why we should not aim for losing more than 1 pound a week or 10 days. And that is, homeostasis is a process where our body tries to maintain everything the same. So somebody that is overweight and is trying to lose weight will have a hard time just as much as somebody that is underweight and is trying to gain weight, because the body is trying to keep everything the same. So somebody that is overweight and tries to eat less, the body will slow down the metabolism, and the opposite applies to somebody that is trying to gain weight. So the important thing is, if you suddenly go on a drastic diet where you reduce your calorie intake by 1,000, 1,200, dramatic, aiming to lose 10 pounds in a week, your body will slow down your metabolism because it's thinking that is the starvation, it goes in the starvation mode and thinks that the food is scarce and is trying to conserve. Therefore, it slows down your metabolism so you don't lose weight as much. The key is to do it in a way that your body doesn't realize that you are doing this, so that you're not breaking up the homeostasis that the body is trying to maintain, and so that it does not slow down the metabolism. In fact, there are ways to speed up your metabolism to help you lose more calorie throughout the day. For instance, if you have a big breakfast and do an exercise earlier in the morning, your body metabolism will be a bit faster because your body knows that you have lots of food. It can go ahead and do its maximum metabolism. Now, if you starve yourself, you skip breakfast, have nothing, your body will slow down your metabolism and will burn calories slower because it's trying to maintain it, because it goes in a starvation mode, thinking that the food is going to be scarce, so it doesn't burn off as much calories. In fact, many people don't know that 80% of the calories that you lose is from your basic body metabolism, the energy that is used to breathe, to digest food, to oxygenate the blood in your body, those systems. Only about 15 to 20% is related to activity level. So the trick is not so much how much more exercise you can do, but how much more calories you can burn. So if you were to have a big breakfast and then a moderate lunch and a small dinner without a carbohydrate, that would be the best deal. You start off with burning a lot of calories, And towards the end, when you go to bed, that's the slowest time of burning calories. So you have least carbohydrate and the least calorie for your dinner, and that would be the optimal. In fact, you can have 3,000 calories, but have big breakfast in the morning and more slanted in the morning, and still lose weight compared to somebody that has 2,000 calories, but they skipped breakfast and they had large lunch and larger dinner. So how you eat and when you eat is more important than what you eat and how much you eat. One of the biggest problems with losing weight is the snacking, especially evening snacking. One of the ways that I deal with this is to get out there for a walk, or often I go out for a bike ride, enjoy the beautiful scenery, and other than a bottle of water, I don't carry much with me. And in fact, when I'm at home, I notice that I get bored, and that's why I go and visit the fridge. I often have healthy stuff. I have yogurt and I have fruits, but they all also have calories. Even too much of a good thing is not good for you. Everything with the calorie counts. So one way that I have found to cut down on snacking is to getting out there, enjoying the nature, going for a walk, going hiking, or going for a bike ride. And in addition to skipping having a couple of fruits, which could easily add up to 200, 250 calorie, I end up losing another 200, 250 calorie by doing some exercise, which I don't see as an exercise. I see more as enjoying myself and the outdoors, but nonetheless losing the calories. In the comment section, tell me, what do you do to prevent snacking and being bored? One of the important things with dieting is proportion, and one is portion. So you want to have a smaller portion, and in general you want to have the largest meal of the day to be your breakfast, the second largest your lunch, and the third your dinner. And often in the dinner time you want to avoid carbohydrate as much as possible. Regarding portion, please do refer to my previous video on healthy eating. And basically you want to have 50% of your plates to be vegetables and fiber basically, and 25% to be complex carbohydrates, and 25% to be lean protein. Now we talked about portion and proportion, as well as timing of your meals to maximize your metabolism. We talked about snacking and trying to reduce snacking, as well as increasing physical activity. So essentially the secret is not much of a secret. It's all about lifestyle modification. So you want to do something that you can stick to. So it's not a 2 weeks diet, 3 weeks diet, yo-yo diet, but you want to change your lifestyle for healthy. By doing these things that we talked about, you will reduce your sugar, you will reduce your cholesterol, you will reduce your blood pressure, and thereby reduce the risk of cardiovascular, including heart disease and stroke, which is more people die from cardiovascular conditions than they do from all cancers combined. So if you want to live longer and a healthier life, modify your lifestyle and you will automatically lose the weight, become healthier, become more in shape. And don't do it just for the looks or the dress size. Do it for being healthy, living a long, happy, healthy life. I hope you enjoyed this episode of Your Body, Your Health, and I do appreciate you giving comments in the comment section, as well as pressing like if you did like this talk. I would appreciate if you subscribe so you can get all of the videos that I post, and let me know what you guys want me to talk about. Also, if there's enough interest, we can do a weight loss challenge. If you guys are interested, if there's at least 10 people that are interested, I will join a weight loss challenge where together we will work on losing 4 to 5 pounds in a 1 month period, and I participate too. I can always help losing a few pounds. So let me know if you're interested. Let's do it together. Once again, please do subscribe and hit that like button if you find this to be interesting. And as always, I would appreciate if you share this video. Let's get this world across and get everybody healthy.